Healthcare is an essential aspect of human life, and the question of whether it should be considered a right is a contentious issue that has been debated for many years. Advocates argue that healthcare is a basic human need and should be provided to everyone, regardless of their ability to pay. On the other hand, opponents argue that healthcare is a service that should be paid for like any other good or service. One of the primary arguments in favour of healthcare as a right is that it is a basic human need. Human beings have a right to a certain standard of living, which includes access to healthcare. People need healthcare to maintain a healthy and productive life, and denying them healthcare access is a violation of their basic human rights. By providing healthcare services to all, regardless of their ability to pay, society can ensure that everyone has access to the same level of care, regardless of their economic status. Another argument in favour of healthcare as a right is that providing access to healthcare could improve the overall health of the population. By giving everyone access to preventive care, such as regular checkups, vaccinations and screenings, healthcare professionals can detect and treat diseases early, reducing the need for costly treatments later on. Additionally, by providing access to healthcare, people would be more willing to seek medical attention for illnesses and injuries, which could prevent the spread of contagious diseases and reduce the severity of injuries. Furthermore, a healthy population is a productive one. Illness costs the economy an enormous amount of money each year. When people miss work or are unable to work entirely due to illness, everyone in society suffers. So it is in the interests of everybody to keep the populace healthy. Opponents of healthcare as a right argue that healthcare is a service that should be paid for like any other service, such as food, housing and education. Providing healthcare to everyone, regardless of their ability to pay, could strain the economy and limit the resources available for other necessary services. Additionally, if the government provided healthcare to everyone, it could lead to longer wait times and poorer quality of care, as demand for healthcare services outstrips the supply. Another argument against healthcare as a right is that it does not address the root causes of poor health. Many health problems are caused by lifestyle choices, such as poor diet, lack of exercise, and smoking. The government providing healthcare for everyone does not necessarily encourage individuals to take responsibility for their own health. And instead, people may continue making unhealthy choices if they know they can rely on the government to treat their illnesses. The question of whether healthcare should be considered a right is a complex issue that has no easy answer. Supporters argue that providing free healthcare to all is good for everybody's health, happiness and the economy, and is not only ethically correct, but also economically sensible. On the other hand, opponents argue that providing healthcare to everyone could strain the economy and limit resources available for other necessary services. Ultimately, policymakers must weigh the costs and benefits of the different approaches and decide what is best for their constituents.